All right, thank you for staying with the Money Report Town Hall. Let's get first-hand experience from Simon Mushene Njoki. He's a vaccine recipient all the way from Dubai, but he's a Kenyan. Simon, thank you so much for making time for us. Just what made you decide to take this vaccine?
I think it's because looking at the cases in the world, I don't want to be a victim of the virus. That's what led me to take the vaccine.
So walk us through the experience. How was it from the moment you went there? What happened?
So it was voluntarily. So you first go to the center.
Yeah.
They'll ask you if you have any blood pressure or any other any other chronic diseases. If you don't have, there is a form you need to fill up. And then once you're done, they'll give you the first jab, which stays until you're gonna stay from 21 days to 28 days so that you can take the second one.
Did they give you any warnings that there's a possible side effect? Were you scared that you might get a possible side effect?
Yeah, they told us there might be side effects, but for me, the first jab, I didn't get any side effects. But the second jab, whereby I got a very severe headache, but they told us when you have such side effects, you can take a painkiller.
Did they explain to you that this headache is a side effect, or was just a headache that you're going to get anyway, despite having the jab?
It was part of the side effects. So some of the guys or some of my colleagues have body pains. Some others have like flu. Myself, I got a headache. This was the second jab.
Did you ever contract COVID-19 before the vaccination?
No.
And how come you got the line? How did you get to the front line? Is it that in Dubai it's being given to everyone, or are you one of the frontline workers?
So in Dubai, they're giving any adults from 18 years of age up until 70 or above. So I work in a hospitality industry whereby the vaccination center is at our place. So yeah, we got the first jab.
Now that most people have gotten the jab in Dubai, is there a difference in the general way people conduct themselves, or is it just the same as before the vaccines came through?
So in Dubai, wearing of mask is mandatory. If you don't have your face mask, you tend to get a fine, and it's a heavy fine. So yeah, it's a mandatory. Even after the vaccine, you have to be wearing your mask.
So before you got the vaccine, did they tell you that everything else, all factors must be held constant? You keep washing your hands, you keep wearing the mask. So then what is the use of the vaccine then?
Yeah, so they told us even if you take the vaccine, it's a mandatory for you to keep washing your hands, putting on the mask when you're in public places. Yeah, so I think it helps in a certain level whereby you cannot contact the disease easily.
Generally, do you feel people are more confident now in Dubai as you walk around? Are they more confident that there's vaccines everywhere, or do people still have that skepticism?
Yeah, now people are walking with no fear. Businesses are starting to come back. Like tourism is starting to, tourists are starting to come back. So yeah, it's becoming more easy, and business is becoming more better.
How are they dealing with the misinformation around vaccines, that it has random side effects, it will be intense? How are they communicating this to the public for them to accept that the vaccine is a good thing?
So there is like, they're giving education. You get to learn which vaccine to take, how to go about it, and there's a lot of education going around.
So do you get a certificate after the vaccines have been done, so that, or do you still have to go and get a COVID test anytime you want to travel at the airport?
Yes, we get a certificate. This is after the second jab. Actually, I have mine. If you'd like me to show you, we have, yeah, but when you're going for, maybe you're traveling, you need to take a PCR test.
So even after the vaccine, you still have to take another PCR test?
Yes.
Isn't the vaccine certification enough?
It's only like, for example, for us, if you are moving from Dubai to Abu Dhabi, then you don't have to take a PCR test. But if you're moving from Dubai to maybe Kenya, you need to take a PCR test.
All right. Thank you so much for speaking to us. Simon Mushene Njoki is a vaccine recipient in Dubai. He says he still has to walk around with his certificate and still get a PCR kit. And let me bring back Prof into this conversation. Prof, will that be the same situation for Kenyans as well? Even as after you have the certificate showing you've been vaccinated, you still have to do a PCR test anytime you travel?
Oh yes, we will still need to do that. I think this is we should look at vaccination not as an event, but as a process. That at the beginning of the vaccination process, that will be the reality. But with time, once we remember we talked about reaching as a level where transmission has been reduced. Then I foresee a situation whereby all that will be required when you're traveling is to show that you've been vaccinated.
And at what level would that be?
So at the moment, we still can't say for sure. As I say, we have to keep on monitoring to see how the transmission is going. So, you know, there are some countries, for example, like you remember New Zealand at one time did not have any new cases for a long period of time before they started seeing new cases. You can imagine if majority of the countries in the world are not seeing any new cases, that will be a very comfortable place to be in. And all you require now then is that if you are meeting anybody from outside your territory, a vaccination would be a good indicator that they are not transmitting the infection. And again, as we said, even the effectiveness of the vaccine is still being monitored. We still need to find out, get more and more data to show the suspicion that once you're vaccinated, you're not able to transmit the infection. So that, as we generate data, I'm sure we are going to open up the space globally, not just in Kenya.
Prof, you know, one of the biggest challenges, especially for family members who live together, has been social distancing. So if a whole family, for example, gets vaccinated, do they have to be wary about their own people anymore?
Yeah, at the beginning, yes. Remember, Trevor, that this vaccine is not 100%. There is no vaccine that is 100% effective. So even if you're family members and you're all vaccinated, you don't know who the vaccine has taken with regard to prevention of infection. Remember, we said that the vaccine might be able to prevent infection, might be able to prevent severe disease, and so on and so forth. So we still don't know. What our hope is, so let's assume that this vaccine is not 100% in terms of preventing infection, but it is 100% in terms of preventing development of severe disease. Then you don't need to worry about. Even if you are family members and you have all been vaccinated, you then don't need any social distancing within the family, because you know that even if somebody becomes infected, they're not going to get severe disease. The biggest problem with COVID now is getting severe disease.
Okay. So there's another question here, but before we do that, let's bring in Julia Nyamurua. She sent us a video. She's a clinical nurse at the University Hospital Coventry in Warwickshire. She's also been vaccinated. This was her experience.
Yes, I agree. There has been a lot of misinformation about the COVID jab and about, I've heard so many things. A lot is out there on the internet about side effects, about Bill Gates. I don't know. So much has been said. However, in order to deal with that, I went to the Department of Health, which is available. It's a website. I read about the vaccine, and if I may recall well, I remember when I told my sister I was going to have it, and they were like, no, you shouldn't go for the jab. You should wait until maybe they're using you as a guinea pig. And but I went for it, and I was happy and gladly, and I volunteered to go for it. What we've been told, there's still studies going on about the vaccine, and getting the COVID vaccine does not give you immunity forever. It just prevents you from getting COVID at that time. There is also a chance of you contracting COVID after your vaccination. However, that will be in a milder form.
Well, that is Julia Nyamurwa. She's a nurse at the University Hospital Coventry. Prof, are you concerned at the speed at which this was churned out to the masses, considering you've been working on vaccines for HIV for the longest time?
I have no concern because I've read the dossier about the three frontrunner vaccines, the Moderna, the Pfizer, and the AstraZeneca. I'm very, very familiar with the potential side effects that can be generated by the vaccine. And as your two guests who have been vaccinated can testify that these are mild side effects. So I have no concern at all about the speed in which these vaccines have been generated, because I also know the reason why the vaccines have been developed much faster than have been developed in other diseases. We know that there's been a lot of funding that has been made available because this is a pandemic. We also know that they have used technology that has been built on other vaccine platforms that have been used, for example, in developing vaccines against Ebola and against another virus known as MERS-CoV. So I know the reason why it has taken a shorter time, and yet I know also that no step has been jumped in developing the vaccine. They have been tested in animals, they have gone through what we call phase 1, phase 2, and phase 3. So I'm very, very confident about the process that has been followed.
Okay, so let's bring up, there's another question here Mwalimu Mzalendo is asking. He says, ask the prof whether Kenyans will receive 2 standard doses in, or will they get a lower dose first, followed by a higher one?
The Kenyans, we are going to get a standard dose. Now, even in the UK, where that has been tested, where you can, studies show that if you get a lower dose, the first dose is a lower dose, and then you get a second, the normal dose, that the protection was slightly better than when you get two normal doses. But even in well-established setups like the UK, where there are very good data, there are very good tracing mechanism, that is a challenge. Even in the UK, they have opted to give 2 equal doses because you can imagine the confusion that you'll get when they come into the clinic. I don't know whether you're coming in for the first time, so whether I need to prepare half a dose or whether this is your second time that I need to have full dose. You want a system whereby when you come, it is a vaccine. A vaccine is a vaccine is a vaccine, without considering whether it is a half dose or a full dose. So the Kenyan government's decision is very, very pragmatic, and I'm in total agreement with it.
Okay, Prof, we are running out of time here, and I have a few videos I want to play for you, all of them at the same time. But before we do that, Steve Osvaldo is wondering, can you take all the vaccines to increase your immunity at a go? Why do you need that gap of 21 or 28 days?
Okay, thank you for that. You see, the idea about the vaccine, the way the vaccine works, the first dose that you get is something called a prime. It primes your immune system. What that means, it alerts your immune system that it has been given a vaccine, so it prepares it. And then when you get a second vaccination is what you call a booster. So a booster then makes the immune response that you've generated to grow even into a much higher level than the initial dose. So there is the reason why you give 2 vaccines, vaccinations, is because of the way the vaccine works. Now there are vaccines like the Janssen vaccine that was recently launched, where you only need a single shot, because with that single shot of the vaccine, the immune response that is generated is at a very high level, equivalent to the other vaccines being given in what we call a prime boost fashion. So that is an ideal vaccine. And my hope is that as we get more and more vaccines, we are going to get better and better vaccines. And the ideal vaccine is one that you give
Okay. Prof, I seem to be having a bit of a challenge with your sound. Let me play the questions we have for you and then I'll come back to you to respond.
How much will the vaccine reduce the threat of the COVID-19 pandemic?
With the new variant of the COVID-19, is the vaccine going to be effective? Also, once you've gotten the jab, does that mean it is the end of now wearing a mask or just taking care?
The government has taken the right step in importing vaccines. However, there's a need to build local capacity so that we as a country are able to produce our own vaccine. Remember, we had swine flu, we had Ebola, and now we have coronavirus. There's a need for us to invest in the local industries, to invest in chemistry, to invest in research so that we are able to stop this trend of always importing, because we don't know the trends that are going to come in the future.
Who is supposed to be vaccinated? Is it the COVID-19 positive patient, or is it for those who are negative?
All right, Prof, you had answered most of those questions, but there's one on local capacity for our own vaccine. And then now that we're expecting the vaccine to land here tomorrow, midnight, what logistical arrangements should we have in place?
Okay, sorry about my internet connection. But the idea of getting a local vaccine manufacturing capacity is a novel one. But I think we need to understand that developing a vaccine is not as easy as we think. There are many that make it difficult for us to develop vaccines. So that is something that we can aim at achieving, but it should not prevent us from using vaccines that have been made from outside. I think it's the same question you'd ask yourself. Would want Kenyans to have its own vehicles? Would want Kenya to make its own aeroplanes? But the reality is that we'll keep on relying on the Boeings and the Airbuses, manufacturers of the plane. We'll keep on relying on the manufacturers of Toyotas and Mercedes and so on, because manufacturing a vehicle requires more than it's just more than the knowledge of how to make a vehicle. It's the same thing with the vaccine. There's a lot of costs that are going to manufacturing of the vaccine. There's a lot of machinery, equipment, what we call GMP certifications. So it's not as easy as just saying that because we have the scientists who can be able to manufacture vaccines, we go full throttle and say we are not going to use any vaccines from outside. We still have to use vaccines for a long time before we have the capacity to make them locally.
All right, Prof. Thank you so much for making time for us. Professor Walter Jaoko, Professor of Medical Microbiology and Tropical Medicine at the University of Nairobi, also Director CAVI, which is Kenya AIDS Vaccine Initiative. The vaccine lands here tomorrow at midnight, 1.25 million doses of it. Frontline healthcare workers will be given priority. Well, that's how we'll see what more will come through at some point. Prof, are you still with us? There's one other question here that is coming up. What about allergies? People who are allergic to eggs and chicken, should they also be vaccinated?
No, that is very clear that people with allergies should not be vaccinated, because the problem with allergy, and that is not just for COVID vaccines, that applies to any other vaccine. As long as you have allergies, you can develop very serious allergic reaction, and so you should not be vaccinated.
Any sort of allergies?
Yes, if you have a severe allergy, so one of the things that they'll ask you, so we're not talking about people who react to dust, for example, but you specifically mentioned people who react to egg products, fish products. Those people who develop very severe reactions should not take the vaccine.
Milk products?
Milk is okay. So the thing about allergy is the severity of the allergy. So if you get there are people who, when they take milk, they just have a running stomach. That is not the kind of allergy that we are talking about. We are talking about a systemic allergy. So people get difficulties in breathing. There are people who swell, their mouth swells. So it's like they have been stung by a bee or a wasp. That kind of allergy is what we are concerned about.
So in a nutshell, if you have any severe allergies, stay away from the vaccine.
Yes, sure. Yeah. And that is the instruction of even of the manufacturers.
All right. Thank you so much, Prof. That's a clarification I needed to get. Professor Walter Jaoko, Professor of Medical Microbiology and Tropical Medicine, also Director CAVI. Thank you for clarifying that for us. We leave it there for now. This has been the Monday Report. It's such an honor having you always. We'll try and keep this conversation very vibrant for you to ensure that you have all the information you need in the vaccine. Remember, it's voluntary, so no need to panic, but you need to have all the information, right? Bye for now. On behalf of the entire team that made this possible, thank you so much for watching. My name is Trevor Ombija. Always a pleasure having you with us. Wilson Mushora says thank you. See ya.